fact, when I went through the course in 2000, so I came back and I spoke to my family, and then I spoke to my boys. They were both adolescents at that time. I told them, if you ever feel differently, you should just tell me, and that's fine, that's all right. So they laughed. They thought it was very funny that their mother was talking about all this when they were trying to have girlfriends. So I'm Lata Hemchand, and I'm a clinical psychologist. Been in practice for last 35 years. When I passed out from NIMHANS, the understanding definitely was that homosexuality is, that's what we were taught there, that it is a deviation which requires to be treated. So aversion therapy was one of the methods. Very unfortunate, but that's how it was. I also felt very uncomfortable doing what I was expected to do. This opportunity came up for me to associate myself with an NGO which is based in Chennai, which works with HIV/AIDS. That was kind of a turning point in my understanding of a lot of issues around sexuality. So when I met people of homosexual orientation, many of them sort of would give me their story of how they came out, what happened to them, and how they grew up, and how much they had to face because of their identity, and how they couldn't even talk about their identity. That was really, it just opened my world, a different world for me. Whatever little doubts I had, I think completely got dispelled with that. And I felt that, in my capacity as a professional, I should always help in this cause. And so I took that stand, and I said we have to abolish this practice completely. And after that, I have not looked back. In the sense, there was no need for me to look back. Even if it is not in the majority, it does not mean it is not normal. I have always been supportive, and I am quite convinced that that's the only way to be. I'm optimistic about what care and what support we can give, despite the law being not in our favor. What I see is, yes, there is a definite shift towards understanding people from LGBT community, and also being more empathic and supportive. I do see that shift. I think more discourse and debate has to happen. I think we need to gather that strength from others as well and push it as hard as we can.